The most significant and pleasing aspect of the care I received was that I felt cared for and valued as a person. The staff were very busy, but it was clear that everything had to be run like clockwork to fit in all the patients in the ward. However, the support and information, communication and everything I received was in really strong supply. I felt there was excellent communication with the staff. What I felt most, that it was good that they knew about my family, especially my son was studying for exams at that time, and the staff used to ask me on a daily basis how he was doing each day. I felt that they saw me as a person and not just as a patient having surgery. I was amazed by the standard of care that I received at the Golden Jubilee National Hospital.
Walking into the hospital, walking into the hotel, it's the brightness and the cleanliness of the whole place, staff being friendly and approachable, and it's a nice environment, you know, to work in. It's a nice place, a nice clean place to work in.
Well, part of the nursing philosophy is wanting to give a high standard of care, not only and support not only to the patients and their relatives, but to the staff, which I've seen just any person that's admitted to any of the wards that I've been on, their relatives are right away taken in and everything's explained not only to the patient but also to the relatives, because not only is it a scary time for the person actually coming into hospital, but sometimes it can be quite scary for a partner. Also the staff as well, are well supported. From a student's point of view, I've always felt that I've been highly supported in any of the placements within the hospital, and just as a multidisciplinary team, they work really well together with like, the physios and the occupational therapists, and the protected meal times are kept here as well, which is a good thing because the patients then know that when it comes meal time, they will get that hour and a half where no one will be in to take them for tests or to do anything with them while they're eating their meals.
I mean, there's a difference between hearing and listening. You can hear things, but listening to things that they say is more important than actually hearing what they say. And I think that is one of the most important things, you know, in developing your relationship with patients.
I think it's very important that they're all individuals. We see a whole variety of patients day to day. You're never quite sure who the next patient is going to come through the door to us is. So they've all got their own stories, their own life events, experiences, and I think each one of them have got their own challenges that they bring to us. So they are all very much individual, and I think we try, certainly in the coronary care unit, to treat them all and meet their own needs as much as possible.
And that's one of our specialist roles, is, you know, trying to look after somebody that can't tell you, and just remembering how you would want to be treated if you were lying there. If you always think back, if I had a family member lying there and I saw how they wanted to be treated, I would always make sure I looked after them the way I would want to be treated.
That's been one of my philosophies throughout nursing, is to always treat the patient the way I would like to be treated myself.
I think it's really important for the patients to feel that they've had personalised care and that they feel that valued, and you know that we've actually made their experience a good one in the ward. A smile, you know, just the way you speak to the patient, communicate with them is actually, I think, more important to the patient again than just purely carrying out a task. Anyone can walk in, do a task and walk back out, but it's how you approach them, how you communicate with them, and that actually makes them feel, you know, valued and that their stay's been a good one. And all the feedback we get back from patients is purely around how staff have been towards them and how their attitude has been.